Welcome to the Introduction to TRICARE briefing. The goal of today's presentation is to give you a general understanding of your TRICARE benefit. We will discuss the various program options available to you and your family, as well as the steps you should take to get care. Today we will discuss what TRICARE is, how to establish your eligibility, and the medical coverage available to you. We will also cover other important information, including overviews of the pharmacy options and dental programs. Finally, I'll provide you with important contact information so you can get assistance and find answers to any additional questions you may have. TRICARE is the Uniformed Services Healthcare Program for active duty service members, or ADSMs, active duty family members, or ADFMs, National Guard and Reserve members, retirees and retiree family members, survivors, and certain former spouses worldwide. Please note, throughout this presentation, the term family members means dependents of service members who are eligible TRICARE beneficiaries. TRICARE brings together the healthcare resources of the military health system, such as military treatment facilities, or MTFs, with a network of civilian healthcare professionals, institutions, pharmacies, and suppliers. TRICARE has no pre-existing condition exclusions, so you cannot be denied TRICARE coverage because of a health condition you had before becoming a TRICARE beneficiary. TRICARE is available worldwide and managed regionally. There are 3 TRICARE regions in the United States: TRICARE West, TRICARE North, and TRICARE South. Your benefits are the same regardless of where you live, but you will have different customer service contacts based on your region. If you are in the North region, your contractor is HealthNet Federal Services. HealthNet partners with the military health system to provide you with health, medical, and administrative support, including customer service, claims processing, and authorizations for certain healthcare services. Customer service information for each region will be provided at the end of this presentation. You and your family members must be registered in the Defense Enrollment Eligibility Reporting System, or DEERS, before you can be eligible for TRICARE benefits. DEERS is a worldwide database of service members and dependents who are entitled to military benefits, including TRICARE. Service members or sponsors should be automatically registered in DEERS. However, you must register your family members in DEERS for them to be eligible for TRICARE coverage when you are activated. To register your family members, visit a Uniformed Services ID card issuing facility or mail the information to the Defense Manpower Data Center Support Office, which manages DEERS. To register your family in DEERS, proper documentation is required, such as a marriage certificate, divorce decree, and/or birth certificate or adoption papers. In the sponsor's absence, an individual with a valid power of attorney can add or remove family members. At any time, you can verify eligibility through the web, through the MTF's Patient Administration Office, or by contacting your service's personnel office. You should know that providers are legally permitted to copy military and dependent ID cards to verify TRICARE eligibility. Anytime your status changes and that change is reflected in DEERS, family members registered in DEERS will also have their eligibility and status changed accordingly. Once you and your family member are registered in DEERS, be sure to keep addresses and other contact information up to date for all family members. Keeping DEERS information current, especially your address, is critical to ensuring uninterrupted TRICARE coverage for you and your family. While only the sponsor can add or remove family members in DEERS, both the sponsor and adult family members can update contact information. Anytime there is a change in family status, such as marriage, birth, adoption, divorce, or death, the sponsor must update DEERS. Promptly update your information when any change occurs, regardless of active duty status. You can update your contact information in DEERS online, by phone, or by fax. For more information, go to www.tricare.mil/DEERS. If you prefer to update your information in person, you can visit an ID card issuing facility. Please note, be sure to register newborn or newly adopted children in DEERS within 60 days of birth or adoption. Prompt registration of children in DEERS can help make sure you don't have delays or problems with coverage and claims processing. TRICARE Prime offers affordable and comprehensive health care in specific geographic areas called Prime Service Areas, or PSAs. Prime service areas are areas near MTFs and other areas where regional contractors have established TRICARE Prime networks. Beneficiaries eligible for TRICARE Prime include ADSMs and their family members, retired service members and their family members, survivors, certain former spouses and other eligible beneficiaries, such as Medal of Honor recipients and their family members. Please note, not available to all beneficiaries ages 65 and older who are entitled to premium-free Medicare Part A without an active duty sponsor. With TRICARE Prime, you will have an assigned PCM at an MTF or within the TRICARE network. You can also see a TRICARE authorized provider other than your PCM without a referral for additional costs, not available to ADSMs. ADSMs living and working more than 50 miles or a 1-hour drive from a PSA and eligible family members living with them may be able to enroll in TPR or TPR ADFM. To remain eligible, ADFMs must live with their sponsor. However, there are two exceptions. When an active duty sponsor has a follow-on unaccompanied assignment, or when a National Guard Reserve member living in a TPR location is called to active duty for more than 30 consecutive days. With TPR, you will choose or be assigned a PCM for routine care. If there are no network PCMs in your remote area, you can see any TRICARE authorized provider for your routine healthcare needs. The US FHP is a TRICARE Prime option available in 6 service areas across the United States. It is available to ADFMs, retired service members and their family members, eligible survivors, eligible former spouses, Medal of Honor recipients, and their family members. ADSMs are not eligible to enroll in the US FHP. Once you are shown as eligible in DEERS, you will more than likely be covered by TRICARE Standard and TRICARE Extra. TRICARE Standard allows you to use providers outside of the TRICARE network and may be more costly than using TRICARE Extra. You are using TRICARE Extra when you visit a network provider. No enrollment or enrollment fees are required, but annual deductibles and cost shares apply. Please note, active duty service members are not eligible for this option. TRICARE Young Adult, or TYA, is a premium-based option for qualified unmarried dependents who have aged out of their TRICARE options, but have not yet reached age 26. TRICARE for Life is TRICARE's Medicare wraparound coverage, similar to Medicare Supplement. When you are eligible for both TRICARE and Medicare, Medicare is your primary insurance, and TRICARE acts as your secondary payer. No enrollment fees are required. TRICARE Reserve Select is available for members of the Selected Reserve of the Ready Reserve, their family members, and qualified survivors. TRS is available for purchase by members of the Selected Reserve of the Ready Reserve who are not eligible for or enrolled in the Federal Employees Health Benefits, or FEHB, program. Enrollment is required, and enrollment fees, cost shares, and annual deductibles apply. If the National Guard or Reserve member is activated for more than 30 consecutive days, the sponsor and eligible family members become entitled to active duty benefits. TRICARE Retired Reserve is available for qualified retired reserve members, their eligible family members, and qualified survivors. Members of the Retired Reserve who are qualified for non-regular retirement may qualify to purchase TRR if they are under the age of 60 and not eligible for or enrolled in the Federal Employees Health Benefits, or FEHB, program. Enrollment is required, and enrollment fees, cost shares, and annual deductibles apply. The TRICARE pharmacy benefit is available to you regardless of which TRICARE program option you choose. However, as with all TRICARE benefits, to be eligible you must maintain your information in DEERS. You will need a written prescription and a valid Uniform Services ID card to have a prescription filled. There are 4 pharmacy options. Where available, military treatment facility pharmacies are the least costly option. You may also want to have your recurring prescriptions filled through the TRICARE Pharmacy Home Delivery. If you need a prescription filled immediately, your best option is to find a TRICARE Retail Network pharmacy. The most costly option is a non-network retail pharmacy. TRICARE has partnered with Express Scripts Incorporated to provide home delivery and retail network pharmacy services. For more information, visit Express Scripts Incorporated at www.expressscripts.com/TRICARE. There are 3 TRICARE dental programs depending on your beneficiary category. The Active Duty Dental Program provides civilian dental care to active duty service members who are unable to receive required care from military dentists. ADDP is administered by United Concordia Companies Incorporated. Care is provided to service members who obtain referrals from their military dentists or who live and work in remote locations. Please note, ADDP is only available in the United States and U.S. territories. Also administered by United Concordia, the TRICARE Dental Program is available to eligible active duty family members and National Guard and Reserve members and their family members. Care is provided by participating dentists, and you can use the Find a Participating Dentist tool on the TDP website to find a dentist online and or suggest a dentist to be added to the participating dentist list. You can also obtain services from a non-participating dentist for higher costs. The TRICARE Retiree Dental Program, administered by Delta Dental of California, is available to retired service members, including retired National Guard and Reserve members and their eligible family members and others. Care is provided by TRDP Network dentists, and you can use the TRDP Dentist Directory to find a dentist. You can also obtain services from a non-network dentist for higher costs. Visit the websites provided for more information. The following contact information provides the stateside and overseas regional contractors, as well as other important information outlets. Remember, your regional contractor is based on where you live.